Today's episode is brought to you by the Hippocratic Collective. Check out all our shows and content at hippocratic-collective.com. Welcome to this week's episode of Surgeon Interrupted. We are so excited to have Dr. Liv Perez joining me today in the studio. She is one of these physician personalities who I have really enjoyed following the journey of online. Liv first started out in family medicine, and then by the end of intern year, she knew that it wasn't the right fit for her. Ultimately, she applied in dermatology and matched, and now she's coming to us as a derm resident. And I think that, of course, there's been enormous interest in her story, how she did it, what that looked like really granularly. And what I also think stands out so much about her and her work, her professional identity and things like that is the history of business experience that I'd love to hear more about, pre-medicine, because you really, I think, are a model of this new generation of physician that's very three-dimensional, just not afraid of or tied down by some of the stuff that's bogged down doctors in the past.
Yeah. Good morning, and thank you so much for having me, Frances May. It's so great to be on your show.
Absolutely. So, truly, I would love if you could introduce to all of us, from the beginning, what was it like at the end of that intern year? I mean, I don't even think that we need to go too much into, for instance, how you ended up in family medicine in the first place. I think that what's so universal about your experience is just that something told you that you needed to make a change, and then how did you do that?
Yeah, definitely. So I I think I first realized that I might be in the wrong specialty around fall of intern year. So I matched into my number one family medicine choice. I was at a fabulous program, very supportive. I had an amazing education, but something started to feel wrong around the fall. We took our in-house practice exam for the boards, and I got a really high score, and not to toot my own horn, but I think it was more reflective of, wow, I feel like there's not as much to learn being a general practitioner as opposed to a specialist. I had always really valued digging deep into a problem. I have an extensive background in basic science research, and I felt like, wow, how is it first year and I'm scoring very high on these board exams? I want to know more. That was the first clue.
And may I ask, just for clarification, this is fall of intern year, so you've been there for a couple months, is
Yes.
that right?
I had a very front-loaded intern year, so I just came off of 9 or 10 weeks of medicine wards.
Mm.
So I had a leg up, but yeah, that's the case. It was very
Wow.
early on, and I wasn't like a stellar student in my medical school. I was like, ooh, I want to know more. I want to go home and study all the time. And there wasn't a lot more to study.
That's so interesting, and especially, for comparison, it's funny because ENT, we always took that practice test in March, so, it's interesting that you guys took it so early, and yeah, I mean, that's a little mind-blowing that you took it so early, your first year of residency, and just, knocked it out of the park, and it's interesting because 'cause you're almost describing, it was demotivating in a way.
Yeah, I'm a giant nerd and love learning and love studying.
I think that that's such an interesting concept. I'll just speak to it really quickly. As an attending, I mean, I would say, yeah, as a general ENT attending, there was some of that, right? So this is just your life. You've arrived at it. There's a discrete amount of information to learn. Practice looks one specific way. And I do think that when faced with, for high achieving young professionals, when they're faced with, okay, this might be the end of the road, it's interesting that that can be an impetus to jump tracks.
Yeah. And it's not to say, I mean, there was tons more for me to learn on wards, working with patients. But in terms of the fund of knowledge that's tested on board exams, I felt like I wanted to be in a specialty where I could go home and study more. And then there was always more opportunities for digging really deep into a problem. And that's when I was thinking maybe less so general medicine, and I need to look for a specialty.
Yeah, that's so fascinating. And so Derm is very hot right now. Derm is so hot. And so how did you pick derm, and do you feel like there was much backlash to that choice even?
Yeah, so I picked derm for two reasons. One, I had actually done a dermatology research year during medical school. I was interested in derm during medical school, and it's very common at my med school to take a full research year in dermatology. I was sponsored by the NIH to complete a research year. I was in a hair lab. We studied alopecia areata. I had a great year. During that year, I ran a student run free clinic. It coincided with the COVID pandemic, which is why I was more thinking family medicine and I ended up going into FM. But I had already been in a derm environment, loved the basic science. We were in a basic science lab. I loved the basic science research. So derm was already on my mind. A lot of similarities with family medicine because you're working with patients of all ages and you get to work with pregnant patients, which is fabulous. And so it wasn't too far off. And also, I seen a lot of general dermatology in family medicine. So that's the first reason. In terms of backlash, I hadn't announced that I was going to leave the residency until I had fully made a decision. So fast forward from fall when I'm starting to get those feelings, maybe this isn't the best fit. Um, and then getting that reinforcement every time I had to refer a complex dermatology patient to the dermatologist, to the rheumatologist, it was devastating. I wanted to be the one looking at the derm path
Mhm.
slides, thinking of a broad differential, working through the case with attendings, rheumatologists, etc. And it was just devastating every time I had to hand those patients off. So it wasn't until around maybe March that I had fully made the decision to leave my residency. And interestingly, I was the third person to announce that year that I was leaving the residency. So I would say it was it was less jarring because I had two very brave souls announce before me.
All within your program
Yes.
at the time?
Yes. So, and it's not even, I had a fabulous program, super supportive, non toxic. It was just one of my co residents chose the wrong specialty. And then we had a rural version of our family medicine program. And that individual, so technically they weren't in my same exact residency. We did intern year together, but we had like the same program director um, for the most part. And that individual, the second one, they wanted to also switch specialties. So I was number three. I think it was a little less jarring. Um,
Yeah, I think that there's something special about that, almost like when you're not the oldest child. The oldest child's gonna maybe take the brunt of it, but, I think that what's so interesting too is maybe, and I'd love to hear if this was the case at all, but having that many people switch kind of normalizes a new type of conversation and decision within a department or an institution.
yeah, absolutely. And I can't imagine how it was like replacing our work. And I know one of the considerations I felt really badly about is I know that when a resident leaves, everyone else has to pick up the slack. Obviously, it's not as bad as if it's in a surgical subspecialty because we're a mix of inpatient and outpatient. But that was definitely weighing on my mind because I realized, wow, I'm going to just only worsen the problem of people having to pick up the slack.
How big was your program?
I want to say we had 12 residents in the um like city version. I was in like the city track, the university track it was
Mhm.
called. And so two out of the 12 or so of us left. And then for the rural track it was only two people.
And
So
that's total across all the years, you're saying, or
per
per
year,
year?
per
Oh,
year.
okay, per
Yeah.
year.
So it was
Fair enough. Gotcha, gotcha. Yeah, well, it's so interesting because we do need to, like, again, since I only experienced ENT, we had 2 or 3 residents a year, and, like, 5 residents a year is a pretty sizable ENT program and stuff like that. Okay, perfect. So you guys had 12 a year on the university side. You know, what's interesting, because I agree with you, the way that graduate medical education exists right now, whenever something has to give in the system, a person is out for paternity leave or maternity leave, or they leave the program, things like that, the work is pretty much just absorbed by the residents. which is a problem. Having experienced that myself, where we lost the class behind me, I can just say we brought up a lot of other options. Like, for instance, well, what if this stuff went uncovered by attendings? And they're like, no, can't do that. Right. So it has to give somewhere, either from attendings or more help from fellows, or just the residents. And I do think that there's a lack of really like sustainability and also kind of like ethical workplace practices to just make residents to infinity absorb all the work. Because when we lost two residents from that class, there were like 9 of us in the whole program across all the other years to absorb that work. But what
And
I
it's not just absorbing the work, it's absorbing a higher level because obviously interns can't necessarily cover PGY 2, 3, et cetera call. So it's a higher level of work sometimes.
Yes. Yes. But here's what I think is interesting because so I understand what you're saying. I would push back on you experiencing guilt because ultimately, I don't think that there's an obligation that you have to the department to stay on the wrong course or anything like that. But what's interesting and what I've seen people propose, right, is that it should be easier for MDs and DOs to move between specialties easier than it is. Because right now they act like it's some kind of a death sentence or it's going to be a freak one-off occurrence. And that obviously doesn't really benefit anyone. But to me, I could envision people who like find that they need or want to go into family medicine and they go into that university track program that has a couple openings, right? Like, shouldn't there be kind of a bi-directional movement of trainees?
Yeah, and the way it is now, you only have one chance per year to match, and that's through at least for many of the specialties, it's through ERAS. I know other ones have their own special applications, but there's like one chance a year. I think there is something called residency swap. I don't know how common that is. I did not use it. I've never heard of anyone matching through that. Um, so I really wish there was a better system for people to move residencies just because once I started posting on social media about my journey, my inbox is flooded with so many people reaching out, asking how I did it. The interest is huge. Um,
And, I've connected with PAs and NPs who have pointed out, like, they have a little bit more ability to make these lateral moves, right? Like, the specialty commitment does not need to be when you're still pretty young and haven't actually lived, like, any days within that specialty. So I think that that's very compelling. Did you go through regular ERAS?
yes, I did. Yeah.
So then you wouldn't have found out, like, how did that timeline go? You applied the next ERAS cycle, you were a PGY2.
Yeah, so because I didn't figure out until partway through intern year that I wanted to switch, I finished intern year in July. I quit at the end of intern year. And then a couple months later in September, I submitted ERAS. Whereas my colleague who figured it out a month into intern year, he was able to switch with no interruption in his training. So he went straight from PGY1 to PGY2. And then for me, I had to wait. So that was definitely a challenge. And as you know, derm, you match into a categorical
Mhm.
position as a PGY2, but all of the medical students have to complete their intern year, which means I have 2 years of interruption um, in between intern year and then resuming residency as a dermatologist, as a dermatology resident.
Wow.
Mhm.
And, what was your perspective approaching that time? Because, people start to get in their head about that and like, okay, do I wanna make this time investment? What am I going to do with my lost years,
Yeah. And
etcetera?
I think that was one of the hardest parts because I feel like up until then, I had had such a fabulous career trajectory. I've never messed up. I've always like chosen the right path. And so that was a really hard decision to make. I kind of figured it out in an unconventional way. So there is this poster and it's called 4,000 Weeks. I don't know if you've ever seen it. It's called 4K Weeks. And it's literally black boxes and white boxes, and it's each box represents a week of your life. And I have this. It's kind of a little morbid, but I love thinking about death and dying. I did a narrative medicine class on it in medical school. And the 4K weeks shows the average lifespan of however many, 72 years. And one dot, like one box is a week. And I was looking at this poster and I looked at, okay, so if I stay in the wrong career, I have this many weeks, years of my life being in the wrong career. Whereas if I make the change, yes, I have these 2 years of delay. Yes, I'm going to finish training in my late 30s. And that's like a big consideration. But I have decades of being in the right career. So when you see the visualization of 2 years versus a whole career, and it's on a poster and it's in front of you, it makes it a lot easier to make those scary decisions because it's visualized for you and you realize it's like a drop in the bucket in a whole career.
Wow, that's so wise. I really love that. And of course, I'm going to look this up immediately. We can definitely link to it in the show notes and things like that. I think that everyone should maybe have one of these. And I agree with you. I think that reading a lot of like Ryan Holiday's and like
Mhm.
stoic approach to life during my attending years helped me kind of like remember our mortality. Yeah, that helped me. I think that the more that somebody is aware of, very cognizant about their limited time on this earth, the easier it is to make a big decision and like change tracks and just say, well, life's too short. I don't get a special award if I spend 50 more years in the wrong spot for me.
It's so true. And I think that was really helpful in crystallizing my decision because you realize it's such a short time and it's risky because there was a chance I wasn't going to match. But I had backup plans. Like I could have gone back into business, I could have
Mhm.
matched into another less competitive specialty. But I felt like I had to make the change.
Did you just apply in derm or did you dual apply?
I single applied.
Okay, but you were prepared to like soap too if needed, something like that.
My plan, and I think it's really important for people thinking about changing. I wrote out a decision tree, and the decision tree was if I match, great. If I don't match this cycle, I'm not going to soap. I'm going to continue because I had a pretty prestigious postdoc that I was going to be in where I had the opportunity to publish extensively and make a lot of connections. And in certain specialties, including derm, connections are very important. So I wasn't going to soap this time if I hadn't
Mhm.
matched. I was going to continue in my fellowship and try again because it was also my first time applying to dermatology. So I let myself in my head, I was going to say, I'm going to give it 2 shots. And then if the year after, if I applied again, didn't match, then it was going to be a decision whether to soap or go back into business.
I love that so much. I think that what resonates with me a ton is just the fact that everybody, wants the end product. Nobody wants to see how the sausage gets made. Because I do think that it's very easy for, like impressionable students and younger people to see where you're at and be like, this is incredible. Liv just killed it. And like, Liv just walked into it. She just like walked into derm. She made this unusual jump and she just did it. But I really think that the more that we can show like the years and the deep thought and intention that goes into planning, the backup plans on backup plans, like I totally agree with you. When I left my attending job a few months ago, everyone was like, that must be really nice to just like quit your job and not have any responsibilities and not have any backup plans. It's like, you don't live in my house with me. You haven't been watching me. It's been years and years of such meticulous, right? Like there's something we all have in common, which is that even if people don't necessarily like me, I will tell you that among my millions of flaws, one of them is not a lack of backup plans or like really thoughtful, responsible planning.
Yeah. And when you made your decision to leave attending life, you had thought it through very carefully. And when you go to start post on social media, it's like you're not gonna say everything at once, and people only hear bits and pieces of your stories. But a lot of thought goes into it. I think another thing is that there's a lot of anxiety from the uncertainty of like the what ifs. So I think it's important to have the backup plans because it kind of gives you a sense of certainty. Because if you plot out the outcomes, you can plan for what happens in all of those paths. And it makes it a lot easier to make the decision.
That's very true. And was extremely, to an extent, am still extremely that type A person who doesn't like uncertainty. Timetables, backup plans are all comforting. But what's interesting too, I found this reframe super helpful. Until I left my attending job, I hadn't had uncertainty for over a decade, like on the medical track, it's just very certain. You know where you're going to be in 5 years, you know where you're going to be in 10 years, pretty much at any given point. But I was able to, and I think this is a fair direct comparison, look at two choices in front of me. One is the maybe discomfort and anxiety that comes with the unknown that's associated with leaving versus the very significant discomfort and anxiety from staying in the wrong job. And
Mhm.
that's what I think a lot of people discount when they they're trying to repeat my math or they look at the situation and they're like, that's crazy. Like I would never pick the uncertainty. And it's like, yeah, just assume the other option was worse.
Mhm.
I'm a very logical person governed by logic. Like I had two paths in front of me and staying on the wrong one was at significant cost. And so it allowed me to use my agency to say like, yes, under these specific terms and guidelines, I am willing to accept uncertainty.
This reminds me, so I studied neuroscience in undergrad and we had to take a lot of psychology courses. This reminds me of some of the um, like psychological fallacies that keep people stuck in a bad spot. For that, when you're what you just shared brought up status quo bias. People would rather stay in a bad situation than change, because the change is scarier than the reality of the bad situation. And similarly, I forget what it's called, but the bias where a perceived loss is much, much worse than than like a what a gain would be. So people hate losing more than they love winning, if that makes sense. Yeah.
Oh, yeah,
I think
yeah.
the
I've
loss
heard of
aversion.
that. And that
Loss
makes
aversion.
exactly. Well, and so people play it safe. That's kind of like the
Yes.
playing defensive, play it safe. Like I'm not going to lose, but if you play it safe, like you're never really going to have a shot. You're not putting yourself where you could win.
Exactly. And I think that I kind of had all those biases in the back of my head, no, because I knew like this is how the brain tricks you. And the medical training, it just sets us up for so much safety, because if you follow the path and if you're an excellent sheep, you're gonna advance if you check all the boxes. And I think that it was nice having friends in business, seeing them pivot their careers all the time, taking risks, and also having friends in medicine who successfully made the change to see like, oh, it's possible and I can do this too.
Yes, I know that. So mentorship was a big part of what you credit with being able to make the move. And you just alluded to, was 50% of that mentorship outside of medicine and 50% in, or what did that look like for you?
Yeah. So, like I said, I started my career in business. So, most of my friends are not in medicine. And you're exposed to a normal workplace, you're exposed to normal workplace dynamics. And then, yeah, like I said, you see your friends switching careers or going to business school, pivoting, even pivoting outside of business school. So the whole nonlinear path is normalized because you see your friends doing it. And then, yeah, my husband's not in medicine either. So I saw him doing it. That path is just normalized, right? And then the second part of that is fortunately, I had friends and acquaintances who had successfully switched out of their residencies. So one of my closest friends in medical school, she successfully switched residencies. And then someone in my home dermatology program had switched from a surgical subspecialty to dermatology. I knew it could be done. And so I think knowing people who had successfully done it felt a lot scary. And like I said, my co-intern had already kind of paved the way, leaving FM residency.
Mhm.
It just made it less scary.
I love that. What does your husband do?
He's in finance.
Nice. Yeah, it's funny because, you were exposed to all of this from your own business history and then like your close friends from the business side. And it's interesting because, you identified the wrong path a lot earlier in life than I did relatively, right? Like I rode the trade just like legitimately so far.
Mhm.
Not as far. It's not like I think that there are other attendings who have ridden it much farther and are equally miserable. But what's interesting is I am, in contrast to your story, the model of where I was the all in, medicine only, blinders on, no life perspective, no sense of what other jobs are like, gunner. And then I met my husband later. Like I met him on an away my fourth year. So he came to me late. And he even was like, yeah, I had a lot of questions that year. Like there was weird stuff happening in your workplace, but we were newer dating. So he wasn't going to be like, your job is insane. The people you work with are insane. That conversation didn't happen until probably like PGY 2 year of residency, where, of course, by that point, I mean, we were engaged a few years later, like we've been living together. And he's like, oh, yeah, there's totally another way to live. So I had to almost dig myself out of, he had to convince me. It took him years to convince me because I was like, no, no, this is where the cool people are. Like, this is what, if you're cool and you're smart, then you do this. And he was like, it's crazy. You don't have to. So we did all this work to like branch out and get that life experience, which I think that you had and a lot of non-traditional students have all along. They don't need to be like unbrainwashed like me.
It's so true, and I came into medical school with that perspective of what a normal work environment looked like. I was fully convinced I was gonna be a surgeon just like you in medical school. Um, all of my early research was in liver transplant research. I wanted to be a general surgeon, I wanted to be a transplant surgeon. I made it to clinical years. I was just appalled at the way that residents were treated. Because of my gap years, I was oftentimes the same age as residents. It was bizarre seeing people get screamed at in the operating room. A little toxic. The attendings never screamed at the medical students. We had that like bubble of protection. They would scream at their residents and fellows, and it was very appalling. And I think if I hadn't seen a normal work environment, I don't think it would have been so shocking, and I think I would have ended up in general surgery. And that's
Wow.
not to say
Thank you
all
for
general
sharing that.
surgeons are like that. It's just general.
No.
I'm generalizing.
Yes, of course, of course. Not all surgeons, but like way more surgeons than any other professional workplace like tolerates that level of, acceptable malignant behavior. And I really, yeah, I appreciate you sharing that. And I think that similarly, if I had life experience or real jobs or role models outside of medicine, because that's the thing too, right? And that's why we're all here is to give a different type of role model.
Mhm.
Because when the role models are all the surgeons who sucked it up and believe in this one way of doing things, then we don't know like what else is out there. So I think that that's really incredible. And I love that you're out here sharing your journey because again, yeah, you're bringing this like level-headed, hey, what if I had a sense of what's really out there in the world and I brought you good perspective and don't fall for all the fallacies because sometimes your reptilian brain is lying to you
Yes.
and we can't combat fallacies if we can't identify them.
Yeah. And I don't think it's necessarily I think, the surgeons all started out in a really good spot, but I think the hours of training, the intensity, the lack of coverage, I think it's really and like this chronic sleep deprivation, I think it's really grating, um, and it brings out the worst in people.
Completely agree. It's actually sad. I don't think about this too much because it would just make me really sad. But I can tell you that over the years, I have personally known and seen many nice, impressionable, like open hearted, kind young people go into surgery. And then many years later, what's turned out is like a monster. And so, yeah, I mean, I've seen that many times and I can speak to, like, I remember meeting the pre version who, again, is kind of this person filled, um, with like just a lot of love and excitement for the field, and definitely not like, they don't come in with animosity usually. It's what's modeled for them. And like you said, there's all these pressures of the job. And sure, especially when you're sleep deprived, it's really easy to just like act the same way that everyone else has been acting, or you see your senior resident act one way, consciously or not. When you become a senior, you start using the same hateful rhetoric.
Yeah, and that's one of the things that factored into my decision in going into a specialty where I would be able to, um, yeah, like get the normal amount of sleep and have that balance and still be reminded of who I am outside of medicine.
Amazing. Well, no, I love it so much. We don't want people to feel trapped. Even resident physician suicide is a very real, heartbreaking phenomenon, and the less that people feel trapped in their jobs, the more that we even normalize, like, it's okay. You could switch specialties, you can leave medicine, you can do whatever you want. I do think that that will meaningfully help people who even feel trapped in those types of situations.
Yeah, just knowing there's another option.
Mm. Well, thank you so much, Liv. I would love, do you have any final pieces of wisdom or favorite quotes or anything you'd like to share with us?
Ooh. Um, I think something that's been really helpful in my medical career is enjoying the journey. I think a lot of people they don't like let themselves enjoy or celebrate until they get the shiny object at the end. And I think something that's been really helpful in my career has been enjoying the day to day. So for all the medical students, residents, attendings, if they're listening, I think one way to really improve your career satisfaction and just enjoying life is just enjoying the day to day.
I love that. I wonder, I'm going to just even extend this one bit, which is to say, I never understood the enjoy the journey rhetoric in my 20s, but I understand it. I embrace it. I currently live that way in my 30s. What would you say to someone in their 20s who's maybe even heard that advice before, but it's like not getting through to them? It's not clocking to them.
Wow. I don't know because I was always the person who was like traveling the world and enjoying my 20s. Trying to think.
Wow. Yeah, exactly. I'm like, how do we break through to the old me? Because that person was like not living, never took a break. Yeah, it's interesting. We
I
can
wish I
giggle
knew.
on it.
I wish I knew.
Yeah, but I mean, at least let this be like a wake up call. Like, it really, I feel like I wish someone had maybe shaken me by the shoulders, because I loved quotes and I was getting all this good advice from even girlfriends in their 30s and 40s. And but I feel like, especially for people like me who can be obtuse, it's like if you say it in a really low key, gentle way, it will not get through. Like, you need someone to just slap you across the face and be like, enjoy the journey.
I think one reframe is there's a whole population of people out there who are having the best time of their lives, and that should be you too.
Yes, and kind of like lucky girl syndrome. I love that. Liv's story is a reminder that the straight path is not the only one. And yes, it can be high risk, but also high reward to change paths. We love to see it. Other industries have normalized the portfolio and mosaic careers. You can follow Liv's journey and her insights on the intersection of medicine, business, and life at the hospital, both on her Substack and her social media accounts. We will link everything in the show notes below. Thank you so much for tuning in today. Follow me on Instagram and TikTok at FrancisMayMD. Check out our website, hippocratic-collective.com, for more shows and content like this. Thank you for tuning in to this episode of Surgeon Interrupted. If you enjoyed it, please subscribe, rate, and leave us a review.